Hello and welcome to this edition of the SCTS Education Podcast, which is a special annual meeting edition for the 2022 annual meeting. So this is a bit of a preview of what sort of things to expect from the annual meeting. And so we have some special guests today. So we have Mr. Melinda Calcat, who's been the chief organizer of this whole project, and also Daisy here, who is one of our specialist, well, in fact, you introduce yourself, Daisy, because that's best.
Thanks, Caroline, for having us this morning. My name is Daisy Santavan, and I am the Nursing and Allied Health Professionals meeting lead for the Society for 2022. And I'm delighted to join you and share what's going to happen for the meeting in Belfast in May.
Excellent, super. So when I've had a look through the programme, it really does seem like there's something for everyone, and a really wide range of content, I'd say, this year particularly. But Melinda, if you'd be able to tell us a little bit about what your vision for the meeting was, and obviously there's been huge challenges in bringing it to this stage, what with COVID and delays and all things like that. So yeah, what's sort of the driving principle or the themes you were trying to capture for this particular meeting?
Caroline, thank you so much for having us around. Okay, I can't keep going and harping about the content of the meeting. It's a fantastic content, educational content, opportunity for the CPD. Daisy and colleagues have actually brought up such a fantastic program, wet lab research. So it's you go in and you'll come with your brain full of ideas and education and everything. But you know what? For me, there's something much more than this. It was 2019 in London we met. And after that, we have all forgotten how to meet, how to communicate, how to mingle. I think these 2-3 years have really changed our perspective on the way we actually, talk to each other. Just sitting in front of a telly and just looking at the screens, my number have changed so many times. And I think that is something which I really want the people to reconnect, the people to come together. We are a small society of cardiothoracic surgeons, not only in this country, but worldwide. How many cardiothoracic surgeons are there? We need to connect, okay? That is the main reason, and that's the effort we are putting in. We are going to make this meeting a memorable one for everyone, to come to Belfast, to sit with each other, to talk to each other, listen to each other, share our vision, share all the problems we had in the last 2-3 years and how we have come strong and where we are going from here. We have learned a lot from this pandemic, and that's what I want, people to connect, listen to each other, reflect on how we came out stronger and what we can do to prepare ourselves for the future. So that is where I think my vision lies, to have everyone on the plane to Belfast and then come out completely refreshed. So that's how I see this meeting.
Oh, well, that sounds like an excellent plan. I think, and I'm sure it will be. I mean, looking at the programme, there's a few things that stood out to me. There are obviously some focuses on things like COVID and the experiences that people have had through COVID and the things we've learned. So that's quite clear. It's coming through. But also, I've noticed that the main plenary session, we've also got focus on civility in our professional lives, and we've got some experts on human factors, and also one, by the sound of things, a chap who's done both medicine, surgery, A&E, and is also an air pilot, and switched between those careers and bringing those expertise. So I think there's a huge sort of variety, not just about clinical practice and surgery, but also about sort of the wider contributions to our specialty from all sorts of other areas. I think particularly, Daisy, that's where a lot of the sessions in the CT forum come in. There certainly seems to be a lot about how people have got involved with developing services, developing their careers, and looking at sort of wider opportunities within the specialty, as well as the fact that you're giving people opportunities to do wet labs on the university days.
You're right. This year, what we wanted to do was we wanted to address the elephant in the room, and COVID has made us think differently. It has put forward so many challenges. We wanted to address the challenges that every specialty is facing, especially the nursing and allied health professionals, and how we are looking at maybe complementing the existing workforce differently. But we don't want to forget that nursing is all about holistic. Allied health professionals would like to provide holistic care to our patients. It may not be platinum care, but the best effective care that we can provide. In order to do that, there are certain pillars that we need to address, which is research being one of them. So this year, we're bringing that in a big way, talking about international fundings, international collaboration, clinical academic careers, because that is quite in its infant stage with nursing and allied health professional specialty. So we want to push the agenda a little bit more and make it more inclusive, want people to know that it's achievable, have speakers who have done it and can give us tips and hints on how to make it easier rather than reinventing the wheel. So that will be the focus for research. In Wet Lab, again, it has always been a very popular session. And last year, because we had to do it virtually, we didn't manage to achieve that. And there was feedback that people missed it. So again, we've come back with a vengeance, if you like, and we've covered A to Z of cardiac, thoracic, investigations, interpretations, nursing and allied health professionals' role in it's evolving quite a bit these days with specialist roles and how they are able to join the patient pathway and make it as smooth and effective as possible. So that's a wet lab on the Sunday as part of the university day. And the main meeting Monday and Tuesday, we've got a wide array of leadership, education, innovation, again, touching on research a little bit. And we don't want to forget COVID, but we don't want to make it a big central theme. As Maninder said, we want to find out what the learning points were and prepare for what the next decade has planned for us. So yes, it's going to be equipping people with new skills, talents, networking, education, and a bit of reconnecting, which we've all missed in the last 2 years.
Yeah, absolutely. Yeah. I think the networking side of things really comes into its own when it's the annual meeting, if you can attend. I mean, I think when it comes to the virtual meetings, it's actually surprising how effectively you can network in the virtual environment as well. But there's something about being able to see a presentation that you found interesting and then maybe try and speak to the speaker about it afterwards. And I know that that's been a huge benefit to colleagues of mine as well as myself. So no, I think that's a huge opportunity to sort of share expertise, and I can see all sorts of presentations that are in there that I think, oh, that'll be really good. So one thing I wanted to touch on is sometimes the difficulty is kind of trying to get to see everything you want. Now, is there going to be an opportunity to re-watch presentations online? How much is going to be saved? How much is going to be accessible following the conference?
Caroline, I think we had the opportunity last year to run the meeting as a virtual, and it just clicked. Everything clicked and it was a success, and we have learned from that. And for that matter, we decided this year that there will be a virtual component to the meeting. So the people who cannot actually come to Belfast or who are somewhere elsewhere in the world, we want everybody to connect. So there is going to be a live virtual component where people can just log in and can connect whenever they want to and interact with us. So there is a facility for people to ask questions and be a little bit more involved with the whole meeting. And of course, that all content will be available for the participants who have registered to come back. We have also collaborated with SCTS.net, and there will be a content which will be posted on the SCTS.net for the members to preview. So yes, absolutely. I think that's a very good point you have made, that for 3 days, people to sit on the seats and keep looking at the screen may not be possible. But yes, the important the subjects will be available for people to watch. Or on that note, as you had just touched and Daisy has elaborated, we also learned that there are certain important themes where we need to have a little bit more of a brainstorming and blue sky thinking. And for that matter, we have 3 plenary sessions completely dedicated, as as you said, to civility in the practice. That's something which is so sacrosanct and non-negotiable for us, to be kind to each other, to smile at each other, to respect each other. So we have a session dedicated to that. We have a research dedicated to that, and we have gone a little bit away from just connecting to the people. We are connecting with the patient, we are connecting with the trainees, with students and everybody. So it's all encompassing sort of an endeavor to get everybody start thinking about research, why this patient cannot get into research. So that's another component of the whole plenary session, where people will all actually can sit down under one roof and talk about it. So there is a lot going on. And then we really feel proud as a cardiothoracic community to be at the forefront of ERAS. And that's another session where we said, okay, let's sit together, because we found that there were certain specialties which were a little ahead of the others, and then try to again share the learning points and get everybody on that important journey to get the patient in the hospital fit and well, and get him out as soon as he can fit and well again. So there is lots going on, and I can carry on talking about this, but I will leave Daisy and you to share a little bit more about it. Yeah.
Well, I think the one thing I wanted to particularly mention as well is a bit of a mention for the Women in Cardiothoracic Surgery Forum. And I know last year there was a virtual meeting, and we had one of the which is a brigadier from the army, or retired from the army, who's doing public speaking, but she was brilliant, did an excellent session. And this year, I think they've got the European Society for Thoracic Surgery president who's going to be doing a talk. And I just wanted to bring the attention to that, because it's actually, I think it's 8 o'clock on the Monday morning. And so it's when you look at it on the program, it can look like it's a sort of a meeting of some sort. But in fact, that's a talk from one of the presidents of the European Society of Thoracic Surgery. And it's certainly worth listening. Again, I think that's going to be about empathy, actually, and the management of each other and our patients, and should be a really interesting session. So just a little reminder to tune into that, because sometimes these sessions aren't always available following the conference. So catch them live, people. In terms of some of the other things that I've seen on the program, I mean, we've clearly got a lot of stuff that we're covering here. We've got minimally invasive surgery, you've got whole load on congenital surgery, which actually encompasses quite a lot of innovation inside of things. There's talk about some of the use of robotics in there as well. We've also got talks about different sort of lung resection segmentectomies, and there's a lot of discussion about what the different options should be for that at this stage. Is there anything particular, Daisy, that you're looking forward to in this particular conference?
As Melinda was saying, it is such a full-on conference, so I'll be quite stretched in order to find out which is the best session to attend. But between the sessions that we've just mentioned earlier, I think it is of interest to various teams on different days, but each of the sessions are themed in such a way that it will be of some kind of productivity for either the nurses or the allied health professionals attending it. The chairs for this session, we've made a combination of NAHP as well as the surgeons, because these are the personnel who do the operations, and we work in a complementary supporting role. So it's interesting for them to hear as well what's happening in the NAHP world in order to make the whole patient journey so smooth and effective. We've got some keynote sessions in the NAHP Monday, Tuesday sessions, where we've got Beverly Harden, who is the lead for the Health Education England, and she is presenting on what is a focus by advanced practice, because as I was mentioning earlier, there's a lot of evolution of roles happening within the NAHP field. There's a lot of specialist roles. People need to understand what the framework is, what the vision is. So Beverly is going to join us on Monday to explain to us what the focus is for 2022-2023. We've also touched a little bit on mental health and wellness. The focus, as you know, over COVID was a lot on it, but coming out of COVID and remobilizing services, again, that has proved to be very challenging and has put strain on a lot of people. So we've got sessions where we're talking about psychological interventions, not only to optimize the patient journey, but also to help with the healthcare workers who support in them having a smooth surgery and recovery. So yeah, a little bit of focus on that. And this year, for the first time we've done this, we've got NAHP Awards, which we'll be presenting on Monday evening. So we've got categories in perfusion, nursing, advanced practice, physiotherapy, pharmacy. Yeah, so we're really excited about that. This is the first time, and people have gone all guns blazing. They're creating little videos and snapshots. So the teams who've been shortlisted, there'll be 2 in each categories, and there's 7 categories. They'll get to present their work, and then the winners will be announced on that day. So yes, we're excited about that.
And just to elaborate on that, in one of the plenary session, our president is going to be talking about SCTS toolkit, and that's
yes.
where all that is covered quite eloquently. So I think that is important, really important, as how the workforce is going to be working differently in the future, and how we can sort of guide them, help them to reach there. The other thing I just want to impress upon, and that's something people have forgotten, is that they have actually study leave budgets. They have study leaves. They haven't utilized that for the last 2 years. So we need to apply for that. Okay, so people should apply for their study leave budgets. They should apply for the study leaves. We have facilitated some with the industry, some sponsorship for our NHP workers. So Daisy, just remind me.
So in total, we've supported 93 members to attend the meeting this year. So the industry has been fantastic. And again, this has been the first year, and we hope to carry on the legacy in the future years and bring more people to the meeting. Yes.
Great, yeah. And on the note of the industry, we are really been supported a lot by the industry, and we are grateful to them. But also it is important, Carolyn, that in the last 2-3 years, so much changes have happened that actually we need to go to these booths and see what they have to offer. And that is something which we missed again. And that's going to be a real sort of opportunity for the people who attend in person to go to these booths and interact with these industry guys to see what they have to offer. So that's another advantage of coming there. And last but not the least, we have a program full of fun, giant causeway. We have got a pub quiz. We have got a gala dinner, and we have plans to feed people, to have them have great time and not come out of the conference area, and we will look after them.
Excellent. Well, it certainly seems like a really well-balanced and jam-packed program, and I really do think there is something for everyone in it, and I know, looking at it through it myself, I think I'm gonna struggle to see all the things I want to, just because there's so much. So I'm really looking forward to it, and I think there's, with the addition of being able to link up with CTS Net and then hopefully be able to watch some of the key sessions retrospectively as well. So if there's things you missed, just keep a note of it, and you most likely will be able to catch up. So just excellent opportunities, bringing lots of different sort of formats together. So really, over the last few years, you managed to move very quickly from an in-person conference to a virtual conference, and now we've got this sort of hybrid mixed effect where you can do both. Even if you can't get to the full conference, try and come to the university day. There's so many different options, and then hopefully you can maybe catch up with some of the content later as well. So and then for those of us who've managed to get there, obviously lots of things to do, lots of things to engage in. You mentioned about industry there. Just to mention, there's all sorts of I think there's some simulation sessions that Ethicon are running as well, which you can sign up for. again, I'm sure that will be well worth seeing. This is all looking about the future of training, really, and not just the future of training, but the future of us all maintaining our skills as well. I'm sure that this will be a growing area. And talking of training, not forgetting that I'm sure there'll be a trainees meeting as always, and also there'll be lots of students around. I think everyone holding open doors, holding microphones, shuffling people to and fro. I think they're all very keen volunteers from the student population, so we must be nice to them and make sure we don't we encourage them as well hopefully in their future careers in cardiothoracic surgery. So yes, an awful lot to think about, and I'm sure that an awful lot to enjoy as well. Well, I guess we can round up there, but thank you so much for joining me today, and I hope this gives everybody who's watching or listening a really good snapshot of what to expect and what to tune in for, and to try and make sure that you've have a look at the programme, and if you haven't signed up, make sure you do. All right, thank you very much. Bye.
Thank you very much, Catherine.
See you all in Belfast.
See you in Belfast.